How do nurses and clinicians access and use evidence-based best practice information? At the point of care, with Lippincott Procedures and Lippincott Advisor, software within the Lippincott Solutions suite, your staff can instantly access the latest evidence-based procedural guides and clinical decision support references at the bedside to help improve quality of care and patient outcomes. At the point of learning, Lippincott Blended Learning is designed to support orientation and the rapid deployment of need-to-know information that gets staff quickly trained and immediately moved on to productivity. Lippincott Professional Development allows you to address knowledge gaps, meet compliance requirements, and validate competency with hundreds of authoritative, assignable, online evidence-based courses. And to support staff ownership of their individual professional development journey, Lippincott Journal CE and Certification Review provides thousands of clinically refreshed journal articles with CE for nursing and allied health as well as nursing certification review courses. And at the point of reference, your staff can link from the Lippincott Solutions software to more in-depth information found in Ovid, the Joanna Briggs Institute or JBI, and Lippincott journals and books, ultimately improving practice, research, and quality improvement strategies. Now let's see Lippincott Solutions in action. A patient is admitted to the cardiac floor with systolic heart failure with impaired left ventricular function. What exactly constitutes systolic heart failure and impaired left ventricular function? Go to Lippincott Advisor at the point of care to brush up on the pathophysiology behind heart failure. You can also find the most up-to-date heart failure guidelines and definitions in the Clinical Guidelines Summaries section in Lippincott Advisor. With a patient in respiratory distress, a stat chest X-ray is ordered, which shows pulmonary edema. The physician orders furosemide by IV injection and a Bipap mask. What are the proper steps for applying a Bipap mask? Review the step-by-step instructions for applying a Bipap mask in Lippincott Procedures at the point of care before transferring your patient to the ICU. But wait, something is wrong. The patient begins to decompensate. A furosemide infusion is ordered. The nurse starts the furosemide infusion immediately, but then wonders, what's more effective for decompensation? An infusion of furosemide or an IV injection? A quick start with Lippincott Blended Learning Library serves up evidence to show that continuous infusion achieves greater diuresis and has a better safety profile compared to intermittent bolus doses. A quick search in Ovid and the JBI database at point of reference reveals an evidence summary for heart failure decompensation. The nurse finds that a continuous infusion appears to achieve greater diuresis and has a better safety profile compared to intermittent IV injection. She can find more in-depth courses in Lippincott Professional Development to enhance her understanding of these treatment plans. And when time permits, she can catch up on the latest literature on heart failure and earn CE credit with Lippincott Journal CE and Certification Review. In the end, your patient's condition has improved, and you prevented further decompensation and complications associated with heart failure because you implemented evidence-based best practice interventions from Lippincott Solutions. Standardize care, save time, streamline workflows, and improve outcomes with Lippincott Solutions. Learn more on lippincottsolutions.com. With Lippincott Solutions as the foundation, Wolters Kluwer provides you with the latest evidence when and where you need it, when you have to be right.